Our medical correspondent, Dr. Mercy Korir, covered that for us. She now joins us live from our City Centre studios with more details on the same. Dr. Mercy, thank you very much for joining us. What really, just give us details of that deal. What did it entail?
Well, for the clinical officers, their return to work formula was basically just to get them back to work so that they can come back to the table with the Ministry of Health and the 47 county governments, because as it stands, the clinical officers, one, do not have a recognition agreement with the Ministry of Health or with the 47 county governments, which is a requirement for any workers' union to have with its employer. So in the absence of a recognition agreement, technically, the clinical officers cannot get into an agreement with any of the two levels of government who is their employer. So this return to work formula is to get them back to work so that they can have this done. Secondly, they need a CBA now that they are a union, and assuming that they get their recognition agreement signed with both the 47 county governments and the national government, so that after that now they can get back to discussing what really their grievances are. And secondly, they had their discussions over the 22 days that they were on strike. And from the report that they gave us was that the SRC gave them up to B5 as a job group grading. But beyond that, any other discussions, they have to do it within the legal framework. So I think after their own internal consultation and seeing what is the best way forward, I think for them it was to retreat, get back to the drawing board, have all these required legal papers so that they can get into a discussion with the county governments and the national government. So in a nutshell, they are going back so that they can have all this done through dialogue and through other means apart from an industrial action. Akisa.
All right, and as this happens, we are very well aware that nurses continue to be on strike. Just let us in on whether the issue of the nurses, the strike came up during that particular meeting of the signing of that deal.
Most definitely. Here we had the chair of the Council of Governors, that's the governor of Turkana, Nanok. We had the CS Ministry of Health, that's Dr. Cleopa Mailu. We had his PS, Julius Korir, and the DMS, Dr. Jackson Kioko. So there was no way that the discussion of the nurses' strike was going to be avoided. And unfortunately, what we got from the head of the Lane Ministry and the head of the Council of Governors was that they are urging the nurses to go back to work, which is what they had done last week. They said that they have 60% of the nurses at work, but Akisa, remember that we have done spot checks on what is happening in the counties, and the county facilities are operating at 10 to 25% capacity. So why or where the 60% of the nursing workforce is, well, they didn't really tell us where those are. So they continued urging the nurses to go back because they have done all they could, and it's only after they go back to work that they can discuss their CBA and have it concluded. But as we know that the nurses are still out there and are still adamant, they're still holding their position that they want their CBA discussed. And the two contentious issues, according to the ministry, this was now after the discussion, was one, the risk allowance, where the nurses are asking for 20,000 and the ministry or the government is offering them 7,500. And secondly, the uniform allowance, where the nurses are asking for 50,000 and the ministry is giving them 15,000. So according to the ministry, these are the contentious points that the nurses are not agreeing to. But according to the nurses, well, they want the CBA done. It's not just about money. So, well, we're still watching and seeing and knowing that today they are on the 127th day of the strike. We are now going into the 5th week of absence of nursing fraternity in the country. And so, in effect, this means following the doctor's strike that was earlier on, that the country has only had 2 months of working public health facilities. That was in April and May, because that was soon after the doctors called off their strike, and since June the nurses have been out of work, and in effect basically there haven't been any public facilities working.
Okay.
Akisa.
Dr. Mercy Korir there for us from our City Centre studios. Let's just take a look at